Hi there, my name is Bill Frost and I've been a therapist since around 1998. I've also been a lecturer since around 2005 or so with the LCCH Asia and the LSCCH. Today I will be exploring some of the common mistakes we all, one way or another, tend to make along the path to online therapy enlightenment. This will include some of those key setup issues such as lighting, the controversial concept of background audio, positioning of the camera for you and for your client. We'll also take a look at some of the technical challenges. For example, ensuring good bandwidth and what to do when call quality reduces. We will also take a look at dealing with interruptions, concerns around confidentiality, virtual backgrounds, microphone selection, how to use filters or not, and a whole bunch of other things besides if we have time. Finally, we will consider the role of online therapy in the future. So, in terms of lighting, your best option is to get as much natural light into the room as humanly possible. Many therapists like to sit directly in front of a window. That means you're getting as much natural light as you possibly can. If you are going to use incandescent lights, try to use ones that are as unwarm as possible, so more in the direction of the white frequencies. Then you'll find that you won't get so much red in the picture. However, too much natural light from sunlight could result in you almost being blinded. So do consider whether it's appropriate to close the curtains to block some of that natural light out so you can work more effectively. So in terms of how to share sound or how to get background music, if you're into that, I'm not going to go into the arguments in terms of whether background music is a good idea or not, but if you do want to go down that route, then you will find that there are various options to share background music, both within Zoom and other similar platforms. Equally, you could go old school and use a stereo system, and many find that they get a better result by doing exactly that. So there are a number of options if you want to go down that route. However, do bear in mind that by using background music, you may well find that that impedes the audio quality when received by your client. That's a consideration. So let's take a look at camera positioning and where to position you in the frame. Some therapists like to make the experience very personal, like to get almost as close as humanly possible to the camera. If so, do make sure that there's nothing in your teeth. Do also remember that the convention, at very least, is to face the camera when you're talking to the camera. Equally, other therapists seem to try and get as far away from the camera as humanly possible, perhaps also maintaining that ships passing in the night posture, sitting to one side. Do also bear in mind that when you lean back in the chair, so your position in relation to the camera will also change, sometimes to the detriment of the overall picture. So, bandwidth is always a consideration, and there are a whole bunch of things that we can do, both our side and on the client side, to improve bandwidth. We can, for example, ask the client to avoid using 4G and using their wireless router instead. We should do the same. We can close all other programs other than Zoom or any of the other programs, and we can reduce the number of devices using broadband. However, sometimes it is always a matter of reality that bandwidth is poor no matter what we do, and in those circumstances it is appropriate to use a videoless connection, either on your side or removing the video from the client side, or both parties choosing to avoid using video to improve bandwidth and preserve audio quality. However, if you do that, do make sure that your default picture conveys a professional image. Something else to consider is how you're dressed. And do remember that one form of dress code may be appropriate in one circumstance, but somewhat less appropriate and less professional in another context. So something to consider. Now, whilst we can't entirely prevent interruptions, what we can do is prevent a lot of them from occurring in the first place. We can secure our pets, ask our partners as therapists to remain on the other side of the door and to remain quiet. We can ask our clients' families to remain on the other side of the door to preserve that sense of confidentiality and to prevent interruptions. Equally, we need to switch off our own phones and ask the client to do the same. Oh, actually, I've got a delivery. Excuse me. Of course, confidentiality is something that is of importance to us all. And it's important that our environment as therapists remains confidential, so there aren't people wandering around. Equally, it is important if we realize that our patient is in a compromising situation. Let's say they're at work in a busy office, or perhaps they're in a car, or even in a cafe, then it's important that we reschedule until a more appropriate time when they can ensure their own confidentiality. Okay, so another option we have is whether to use virtual backgrounds or whether, as I have right now, whether to use the room exactly as it is and make sure that it's relatively tidy. So let me give you a sense of what some of these backgrounds might look like. We could use something that looks rather like a therapy room. We could also use something quite relaxing, such as a beach video. It can be a video or an image. Or we could select an image or a video that is somewhat more abstract. And do be aware that there will always be these aberrations, both in terms of areas which won't be properly processed, and also whenever there is movement, the background approach will tend to break down somewhat. Also consider the level of contrast between you and your real background. That is what allows, in this case, Zoom to be able to differentiate between you and the real physical background behind you. So make sure there's a good level of contrast. Okay, so how do we get, in this case, Zoom to display a different background? Well, first of all, we need to hover the mouse so that we're able to see the video settings, which are hidden underneath here. So we then select choose virtual background, and then we have a variety of backgrounds that we can select from. I like this one, and that's really all there is to it. If whilst we're there we also want to apply a filter, then we're in the right sort of area to do that more later. If you want to revert that so there is no background at all, again you simply click there again and then click on that arrow, that cross, to close the settings window. That's really all there is to it. Something else to be aware of is the concept of filters. If nothing else, so you can identify when they're being used and perhaps remove them. Filters essentially are overlays on top of a standard image that allow you to alter your appearance. The most minimal one many of us tend to use is something that improves our look and makes us look a little more beautiful, let's say. So that's one generic filter that many of us tend to use, even if we only apply it very slightly. Other filters, such as some of the ones that follow, are a little less subtle. Some of the filters are quite subtle. This filter, for example, emphasizes my eyebrows and gives me a slight moustache and a little beard. And this filter quite substantially applies the touch up my appearance setting, which tends to remove wrinkles and small blemishes, for example. Now, most of the time you'll probably want to remove all of the filters, but if you do notice that someone else has applied them and left them in place, then do look at, in this case, the zoom settings and remove them. If the previous person using the computer used something called Snapchat, then that's a somewhat more involved process and you need to select a different video source. Okay. So let's take a look at how we apply a filter. Again, you need to hover over the video area down here where it says stop video and click on the little hat there. And this time around we'll select choose video filter, and this is zoom again. So, what we're looking for are some of the studio effects, which is a beta facility at the moment. So we click there and we now see many more options than we had previously. I can, for example, if I so desired, give myself some improved eyebrows, maybe make those a little less subtle, or yes, that's more believable. I can give myself a beard, Blaze Royale. Let's try that. And again, I can make that more opaque, so it's more overt. There we go. And I can change the color of it as well if I so desired. If you wanted, you could also put in place a different lip color if you so desired. And you can also apply filters more broadly around the edge of the screen, like so, for example, which is a nice subtle TV effect, or not so subtle. And there are a variety of other ones as well. There are other filters such as adding additional eyewear, for example, or other effects such as this, if you so desired. Perhaps if you were working with kids, that might be advantageous. So there are a variety of filters for different occasions, which you can employ if you so desire. And it's all about exploring to see what is available to find an approach and a filter that works for you. Another concept that we need to consider is what type of microphone to select. Here I'm using a headset microphone, the downside of which is it's very near your mouth, and any sounds that your mouth makes will tend to be quite accurately picked up by the microphone. However, one of the advantages is they are often noise cancelling, so often background sound is almost entirely removed from the equation and is often not picked up at all. The other alternative is a much more sensitive freestanding microphone, the downside of which, although you get less noises from your mouth being picked up, the downside is that sometimes they can be incredibly sensitive and can pick up noise from streets away. Okay, so that's a roundup of some of the issues that I've encountered and some of the lessons that I have personally learnt in my experience of using, in this case, Zoom as a method of conducting online therapy. So I wonder what lessons you've learnt uh, and also where you feel that online therapy will go from this point forwards. Given the option, will patients want to continue using online approaches, or will they flock back into our therapy rooms?